Hello, I'm Michael A. Weiss, and welcome to the Professional Patient Perspective 2-Minute Drill, where the play for today is true healthcare reform equals the combination of ObamaCare, eHealth, and mHealth, both of which are free market solutions. Obamacare is looked upon both positively and negatively as the end-all be-all of healthcare reform. It is also politically charged, but it need not be due to the emergence of eHealth and mHealth as viable sources of healthcare reform. This video explains why. What is Obamacare? It is a U.S. federal statute called the Patient Protection and Affordable Care Act, which was signed into law by President Barack Obama on March 23, 2010. Obamacare ensures basic and very important legal protections for patient consumers with respect to health care. It also makes health insurance more readily available to the currently uninsured. Lawsuits and political debate will undoubtedly reshape Obamacare as time goes by. But for your reference, here are some highlights of Obamacare, which incidentally take effect over different years, beginning in 2010, ending in 2018. Elimination of pre-existing medical conditions by health insurers when they offer health insurance policies. There is a personal shared responsibility requirement, which is often referred to as a mandate, which requires every person to have insurance or pay a penalty or some type of tax for not having health insurance. This same premise is applied to businesses of 50 or more people. There will soon be an internet health insurance marketplace, a virtual marketplace, where people and small businesses can go to compare policies and premiums to ultimately buy health insurance. There will be minimum consumer standards for healthcare insurance, and soon there will be no fee for certain basic preventative care. Health insurers will be prohibited from imposing lifetime dollar limits on essential benefits like hospital stays in the new insurance policies that they offer. Dependents, such as children, will be entitled to remain on their parents' insurance policy until their 26th birthday instead of their 18th birthday, which I believe is how the law now stands. All that said, Obamacare's critics claim that it's way too much government involvement and that most importantly, it completely ignores free market solutions. But I say that Obamacare is just a start, and it has triggered advancements such as entrepreneurial efforts which are leading to additional healthcare reform. These entrepreneurial advancements are eHealth and mHealth, and they are clearly free market solutions. So I think we are getting closer to real healthcare reform. So what is eHealth? eHealth is healthcare practice using computers and the internet. Simply put, think of eHealth as electronic health. The healthcare reform theory behind eHealth is that it's predicated on the widespread adoption of electronic medical records, or EMRs as they are referred to. EMRs are essentially computerized and standardized patient records, which can be shared by various providers in different hospitals in different states across so many different boundaries that it will make healthcare much more cost efficient. Instead of paper, we're now using the computer. I mean, let's face it, the healthcare industry is a multi-billion-dollar industry, and it's run by handwritten notes, and illegible handwritten notes at that. If you look at doctor notes, I mean, lawyer notes are bad. I'm a lawyer, so I could say that, but doctor notes are worse. Examples of eHealth are telemedicine, teleconsults, remote patient vital signs monitoring, the use of computers and the internet for managing and facilitating patient care, and also even electronic prescribing of medications. eHealth essentially brings healthcare into the 21st century. What is mHealth? mHealth, often called mobile health, is the practice of medicine supported by mobile devices such as cell phones. With 2 in 3 people worldwide owning cell phones, and most of them being of the smartphone variety, such as iPhones. This cell phone now works like a piece of high-end medical equipment with all of the attachments, add-ons, and applications, or apps as they're called, so that now this cell phone can also be looked upon as a medical device. And it has spurred a degree of entrepreneurship that I don't think healthcare has seen ever. For example, your smartphone can now examine your ears. It can take your blood pressure, evaluate your vision, perform ultrasounds, track blood sugar, and even the earbuds from these devices can monitor your heart rate. The obvious cost efficiencies from using a cell phone to conduct these very expensive patient tests is enormous. The FDA has already approved many of the usages which I have discussed, and they are quickly evaluating the newest mHealth innovations. Is Obamacare perfect? No. But healthcare reform requires a multifaceted approach due to its complexity and political makeup. After watching videos like this one, I hope people spend the time getting educated in these eHealth and mHealth free market solutions, because entrepreneurs are finally using technology to revolutionize the world's second oldest profession, if you know what I mean. And I'm talking about healthcare. A person's healthcare no longer needs to be a drag on their day-to-day fast-paced life, which has been made possible by all this other technology. Now this technology is being used to help healthcare. And I'm not so sure that entrepreneurs would have focused on this if it wasn't for President Obama deciding to tackle healthcare and come up with Obamacare, regardless of what you think about Obamacare. That's why I consider it an excellent start, and it actually did trigger free market solutions such as eHealth and mHealth. My sincere hope is that these free market solutions regarding healthcare will soften the almost toxic feeling that people have about Obamacare, because I think it's all connected, and one inspired the other and continues to do so. And with that, we have just completed the Professional Patient Perspective 2-minute drill, where the play for today was true healthcare reform equals the combination of Obamacare, eHealth, and mHealth, both of which are free market solutions.